Picture this. You're lying awake at 3 a.m. with chest pain, so you do what millions of us do. You ask ChatGPT, it gives you a detailed response about possible causes, suggests questions to ask your doctor, and even tells you when to seek immediate care. You screenshot everything and head to the ER. But when you show your phone to the emergency doctor, expecting them to be impressed by your preparation, you get that look instead. You know the one, the part eye roll, part frustration with the dash of, great, another Google doctor. Here's the thing, AI can actually make you a better patient and lead to better doctor visits, but only if you know how to use it right. And today, we're getting the insider guide from an ER doctor who's going to tell us exactly how to do it. We have the perfect guest here to help navigate this. Dr. Awais Durrani is a board-certified emergency medicine physician who's become a trusted voice across major news networks like CNN, MSNBC, and BBC, worked in Obama administration on healthcare policy, and is a two-time recipient of the American Osteopathic Association's Excellence in Media Award. He's passionate about responsible AI integration in medicine and hosts STEM City on NBC Houston.
Thanks so much for having me, and thanks for that amazing introduction. I need you to go everywhere with me to introduce me.
Anytime. This is an immediate friendship that we were able to have even just through online connection. And I have to say, when we got to meet, it was so easy. It was authentic, and this is fantastic. Today's conversation is going to be delightful. It's going to be informative. Let's kick it off. We are recording this episode at Health Europe in Amsterdam. Health does such an incredible job, and we were both invited to be here and share our experience of the conference on social media with Medfluencers and Health Europe. Now, you may hear extra noise in the background. It's thousands of healthcare leaders just outside the podcast lounge, networking, connecting, and aiming to make our healthcare better. If you hear a pause, it might be Dr. Durrani and I waving at random people that we met or somebody that we might be meeting right after this podcast. That's the beauty of this health conference. There's so much opportunity for connections. To start off the show, I love to do rapid fire questions. Are you game for this?
I think so.
I think we were meant to do this as physicians, right? This is our thing. And especially with emergency medicine, I'm like, this is your wheelhouse.
Yeah, you need those instant diagnoses.
Yes,
so instant answers for you.
This is what you like. Yes. All right. First one. Since you've worked everywhere from the White House to the ER to television, let's start with some quick rapid fire questions to help everyone get to know you a bit just for fun. So the first one is, do you personally use AI tools to help with your medical practice or TV appearances?
I do, 100% for both of them. I use Open Evidence, which I love. It sources exactly where it gets its kind of medical insights and inputs from. And so sometimes if a patient has a question, I might find a paper using Open Evidence and show that paper to them. And yes, for TV appearances, there's so much happening. Sometimes I use that to condense kind of what the main topics of the day are and then kind of form my own thoughts about that.
There's a lot of information that's coming out sometimes minute by minute. And so having a resource that can tailor and curate it, especially being a physician, is so important. And I agree with you. That is a great resource. Second question, what was the coolest moment or experience you had working with the Obama administration at the White House?
I didn't have health insurance as a kid. The Affordable Care Act gave my family health insurance. And then when I was there, I worked on looking at constituents' feedback and responses on expanding Medicaid in states that were able to do that through the Affordable Care Act. And so being a small part of expanding healthcare to other families like myself, that was very meaningful.
It is. When people can hear about someone who had the benefit, the most important asset in our life, which is our health, and then pass it forward, is huge. I love that. What's your favorite segment or experience you've done on STEM City or with STEM education work?
Oh, that's a hard one. I think it's going to be two answers. One, through the episodes, I get to interact with kids. So sometimes second graders, sometimes fifth graders. Recently got to speak to first graders through my first grade teacher. So she reached out. She's like, the kids watch STEM City all the time. Can you come and speak with them? And so just seeing the smiles on their faces, the possibilities, and saying, hey, you too can do that. I was in your seats with this teacher and able to do all of this, and you too can do that. So that's my favorite. In terms of favorite, like cool moment on top of that, flying in a F-18 fighter jet with the Blue Angels. That's like bucket list number one for me. I got to do that. I think about it almost every day.
That is awesome. Just think of that one kid who got to see someone that may look like them.
Yeah.
May be able to represent their entire life and say, oh, you can do this. You can become a doctor. And planting that seed and being able to technically water it and grow it, that's what you're doing. I love that. Let's start with the truth. When a patient walks into your ER with their phone out, showing you what ChatGPT or internet search said about their symptoms, what's your honest first reaction?
I'll say I'm guilty of kind of what you alluded to in the introduction, right? Like, hey, what rabbit hole may we be going down? But I like to, force myself to take a step back, appreciate that they care about their health, that they searched and did research, and that they're taking ownership of their health. And a lot of times we say, why aren't patients, doing this or that? But that person did that. They did the research. They brought in some resources with them. A lot of times I kind of remind that to myself. Then, kind of go through my history and physical, my exam and whatnot. And I love like when towards the end of that process, they ask me, hey, what test are we going to order? What are we going to do? And I explain it to them. And they may be like, hey, when I searched something on ChatGPT or Google, they talked about this thing or that thing. And then I can kind of provide an educated response to that. Like, hey, but we don't really need an MRI because it's not going to help with your presentation today. Or we maybe don't need this test just yet, but we may get it if we get a certain result on a thing. It allows them to kind of ask me questions, educated questions, and then for almost test me in a way to say, hey, this guy knows what he's talking about. He's giving me a response to some of these concerns that I came in with.
It's an additive tool. And I think if we can look at how AI can not only support, but help our patients really get the best care possible and foster a lovely connection or dialogue between the patient and the clinician, it's a win-win, especially when it's used in the right way. As a frontline emergency physician, how are you seeing AI show up in your day-to-day practice?
I think the most obvious way that I use every single shift is ambient scribe listening technology. And I love it. I, select the patient. I ask them for their permission. I'm like, hey, I'm using this note-taking app to help me take notes. And that way I can focus on you and kind of make sure that we have a great conversation. Is it okay if I use that? And 99% of the time they say yes. I put it in my pocket, don't even think about it. So I'm able to make that eye-to-eye contact. I'm able to listen to all of their concerns, speak with family members, and I come out and I have basically a fully generated note. I personally feel more fulfilled because I can spend more time with the patients. I personally feel like I go back to update them on results way more frequently than I did before using this technology. And then, to be honest, the notes are better than what I would have written a lot of times because they're like, they capture everything, right? A human is not perfect. I may forget that one little detail they mentioned. And so that's probably the most common way. Also in teaching environments, so Butterfly ultrasounds are like the little portable ultrasounds you use. When I'm on shift and, there's 4 med students, I can't spend, 20 minutes with each student because I obviously have to take care of the department, but then somehow provide a teaching experience to them as well. And so the Butterfly ultrasounds have AI technology where if you choose teaching an echo and the student puts that ultrasound probe on a patient's chest, it'll be like, no, you should rotate it 90 degrees to get the type of view you're looking for. It'll label the various parts of the heart. And so teaching med students is a big thing. And then I use it for discharge planning, right? So a lot of times in the ER at 2 a.m., for example, I'm prescribing meds to a patient. Maybe they have a kidney stone, it's really painful, and they really need to go home with pain medication. And they're like, hey, I live in this part of town. I'm not sure where a 24-hour pharmacy is. Well, I jump on ChatGPT. I'm saying, hey, here's my zip code. Where's a 24-hour pharmacy open in this area? It'll give me a list. It'll make sure that that patient can get their medications overnight and that they can be pain-free. So just simple tasks get time of discharge like that.
I loved how you really are intentional with informed consent. I think if a lot of clinicians could say, hey, I just want to let you know that I'm going to be capturing this conversation. Is that okay with you? Just that piece can really foster a trust from the beginning. And we do know the first 30 seconds or even that first 3 minutes with that patient, they're either going to trust you or not. If you can invest in those those just a couple of things that allow that patient to be seen, heard, and valued, that is a fantastic way to make sure that patient gets the best care possible. Also, you as a clinician get the best information from that patient. You grew up in a family where you only saw a doctor when someone was really sick because of limited resources. How does that experience shape the care you give?
100%. I kind of alluded to it before. We had no health insurance, so going to the pediatrician or anything like that was a huge challenge. And where I really realized how it impacted me was I was in my second year of med school. At that time, we had insurance, health insurance, and my dad had a massive heart attack, a STEMI, right? He thankfully got great care. He had open heart surgery. He's doing healthy and well today. But I think to what if that had happened 2 years earlier and he didn't have health insurance? How would that situation have unfolded? And it probably wouldn't have been a good outcome. That really stuck with me. And so now when I see patients, and I see so many patients that have still no health insurance, or maybe they have high deductible plans and they can't afford the medications I'm prescribing and whatnot, it allows me, and I want to help them to make sure that, hey, what kind of community programs exist in Houston or Harris County? Maybe they broke a bone and they need orthopedic follow-up. What are orthopedic doctors that may accept their insurance or that may be cash pay? And so AI helps me kind of find some of those resources, but then calling the social worker, it takes an extra 30 seconds and saying, hey, I have a patient in room 4, I'm discharging them, they're going to need orthopedic follow-up, they have no insurance. Can we make sure we set them up with or give them a few different numbers where they can actually see the specialist that they need to? Because I know what being on the other end of that is like, and you feel powerless, and it's not a good feeling. And so that impacts my care in the emergency department every day, and hopefully for the better. Yeah.
I love how you mentioned that experience would have likely had been different if you didn't have health insurance. Immediately, I thought of, would your dad have been able to get to the rehab facility that he was able to be in? When was the follow-up? Because if you have insurance, if you don't have insurance, we know that wait time can be a lot longer. And unfortunately, in our field, that clinician may decide to augment the type of care they give to that patient based on their insurance status. So for you to be able to find ways to help your patients, because you know the alternative, allow them to get the best care possible so they can land in the right resources, is really that wraparound care that we need to have no matter what. What about this scenario? A patient comes in convinced that they have something serious because AI or an online website like WebMD or Google told them to seek immediate care, but it turns out to be minor. How do you handle that conversation?
I explained to him that just like myself, AI gives you a differential diagnosis, right? It's my job, and AI kind of mimics what humans do, where you think of the worst thing and then you go down the list to the least worst thing, right? And so I say, hey, AI is doing that. Thankfully today, you don't have that worst case scenario and worst thing. And I would also say, hey, having an amazing relationship with your primary care doctor goes a long way. So sometimes rather than turning to AI, maybe you could send a message through MyChart or something to your primary care doctor, and their nurse or someone could respond, and maybe they get you a follow-up that day, or they say, hey, with your conditions and everything, we know it's not the worst thing to worry about. And so I think building that relationship and trust with a primary care doctor is great, because sometimes going online can be scary.
Yes, and I'm completely biased, and I love that you said family medicine, because it's all of us, all the specialties kind of working together to give that patient the best care. Stepping back, I really want to highlight AI in the landscape of what is happening in healthcare. Are you worried that AI will perpetuate healthcare inequities?
I am very worried about that. I think it can equally solve all of the inequities, but it could also amplify them. And the reason for that is we know that our system has a lot of biases built into it. So that means all the data that comes out of that system, all the patient data, is skewed in a certain way. Now, if we give that to AI, it's only going to amplify that skewing and those biases, and it's going to do it at a rate where, unfortunately, it could increase inequities and the problems we have. The flip side of it is AI is very powerful. And so we can account for those biases and issues in the data and correct for those things. We need people like yourself in those rooms to be kind of bringing up that voice over and over again. Hey, this technology is amazing, but what are we making sure where it's not amplifying these issues and historical inequities that have existed? That's what we're at these conferences for, so that clinicians can talk about these things and help the technologists build things that are going to help the patient and not make things worse.
I agree. And I love that one of your passions are really talking about new technology, new things that are happening, but highlighting it from the patient perspective. This is what you should know for your health, but this is also the technology. This is how it's integrated. And these are the things that may need to be kind of tweaked a little bit, but these are the things that you should definitely focus on. When we talk about all of the areas, all the elements of what you do, I can't forget to highlight your social media. Well, your post always starts with Dr. Here, and I love that. It's just awesome. It's a way to invite people in a way that I think people are like, okay, he's here. What can I ask him? What are some ways you detect good health information compared to harmful misinformation online?
Yeah, it can be confusing, right? There's so much of it and it comes at us so fast where even I have to take a pause and be like, is this good or bad? I would say anytime you decide to intake any information online, see who it's coming from, right? What are their credentials? And just because you have credentials, you could still be giving bad information. So that's not like an end all be all. Do a quick Google search. What associations are they affiliated with? If they're family medicine, are they part of the National Family Medicine Organization? Do they have a valid state license in your state? What other things have they said? Look at the other comments. And I feel like getting a holistic perspective of who that provider is and what kind of advice they're giving you is important, because a lot of people's bio may say, hey, they're a doctor in this specialty and have done this, this, and this, but that doesn't necessarily mean, they're going to give you good advice. Also, and this may not be universal advice, but I feel like if someone's selling you something like, hey, buy my protein powder or something, probably biased in some way. So I probably wouldn't be following their medical advice.
I agree. Really look at what is their intent. And I love that you said, although they may be a doctor, doesn't mean they're credible. And I also highlight, even though this isn't universal, are they board certified? That is also a big piece, because there's a lot of influencers, different health leaders who have never completed residency, all the things that we know are really important, have that full package. I've got one more question that I'd like to ask. If you had to give someone 3 rules for using AI to be a better patient, not to replace their doctor, but to work better with their doctor, what would those rules be?
One, I would be don't be shy. Use AI, right? We are at a place where AI is going to be a part of everything we do, including our healthcare. It is good to explore it and see what's out there and what kind of responses it's giving. And clinicians have to learn, but patients have to learn as well. That would be rule number 1. Rule number 2 would be kind of that example that you mentioned where you come in with that example or screenshot of something AI related. I would say save it till the end of the conversation. Because if it's the first thing you lead with, sometimes some physicians, and it's not right, but some physicians may be turned off by that and then they may dismiss some of the things you say. Go through that entire interaction and then say, hey, I searched this thing, and be open about it. It was on ChatGPT or Gemini or whatever. And it also mentioned this. What are your thoughts on this? And once again, kind of like how I ask a patient, can I use this AI scribe? It kind of is asking them, and you feel like a team where you're having that conversation rather than you telling them like, hey, it said I should get this type of test. Why aren't you ordering it? Kind of having that collaborative decision. So those would be my kind of main pieces of advice. And I think it's an exciting time. I think we need to embrace it, but just also be aware of the pitfalls of AI.
I love how you said that collaborative piece from the patient, from the physician. It has to be in tango. Yes, I use that because I love dance, but it's really important. Hey everyone, Dr. Bio here, jumping in from the editing room. We had to dash off to this amazing networking event at Health Europe. You know how these conferences go. 1 minute you're deep in conversation, the next you're rushing to catch up with colleagues. But as I was listening back to our recording, I realized we missed some really important safety tips about using AI in healthcare. I couldn't let this episode go out without covering these. First thing, and listen, this is really important. You've got to stay safe online. Never, and I mean never, put your personal information into AI tools. No full names, no birthdays, and definitely no social security numbers. None of that. These platforms just aren't secure enough for your private data. But here's what you can do safely. Instead of uploading your entire lab report, just ask about one specific number. Like you could type, help me understand what's happening with my body if my fasting glucose level is 101. And here's what I love about this approach. AI actually breaks this down for you. It'll explain that your body might be experiencing early signs of insulin resistance. That means your cells aren't responding to insulin as well as they should. You get this real understanding of what's happening inside your body.
But the part I really love, AI gives you this what you can do section, real actionable stuff like teaching about how prioritizing your sleep can help, simple changes that can actually move the needle. And then, this is the magic part. It gives you specific questions to ask your doctor at your next visit. This is exactly what we're talking about earlier. AI as your preparation tool, not your replacement doctor. Because at the end of the day, you want to walk into that appointment room as an informed, engaged patient. Your doctor will be able to understand your numbers when you come ready with your questions. That's collaboration. That's how this should work. Okay, back to the conversation with Dr. Durrani.
Dr. Durrani, this has been an exact conversation that so many people need to hear in so many different elements. And you've given us a roadmap for using AI as a tool to become better patients, not replace our doctors. I just want to say thank you for being so practical as well as honest about this. Before we wrap up, everyone needs to follow you on social media because your doctor here posts are exactly what people need right now, cutting through the noise with facts about the latest news and our rapidly evolving health system. We will link all of your social media channels in our show notes. So please, everyone listening, go follow Dr. Durrani right now on Instagram, Threads, TikTok, everywhere. His approach to sharing health information and policy updates is fantastic. My hope is you will use his podcast as a resource to find many credible voices online sharing health information. And Dr. Durrani is one to definitely check out. If this episode changed how you think about using AI for your health, drop a comment and tell us about it. Your engagement helps this podcast reach more people who need to hear this conversation. And if something clicked for you today, share this episode with someone who might need these insights too. Here's what I hope you take away. AI isn't your doctor, but it doesn't have to be your enemy either. Think of it like GPS. It can guide you, but you still need to pay attention to the road and use your own judgment. When used right, AI can actually help you have better conversations with your doctor. The next time you're tempted to ask AI about your symptoms, you'll know exactly how to do it smart, not scary. You've got this.